Okay, women are the minds that birth and nurture nations. We are bold, we are smart, we are beautiful, and we are a priority, not an option. Happy International Women's Day to all the women all over the world. Just know that we are exceptional and we are wonderful people, and together we can rule the world. Welcome, lovely people. Welcome. I'm welcoming you all to another interesting moment with us. Lifestyle with Ijinwa. This is the best place to be. Um, this is a place to be because here we talk about interesting things that you need to know about your health. We talk about interesting health issues ranging from male infertility, female infertility, infections, things that you need to know, and the proper prevention that you need to take. Please, I will crave your indulgence for you to invite your friends, invite your family, so that they can join us on this live. And please don't forget to like, comment, and share this live so that other people can join us, because we have something interesting to talk about today. You know, we've looked around, we've seen some prevailing ailments that are prevailing in our society today. And what is that? Fibroid. A whole lot of women come, and you see, you do if you do some tests, maybe you conduct some specific tests in some women, maybe 100 women comes to the clinic. Out of that 100, 90% of them are having this fibroid. And you may ask yourself, why am I having fibroid? What are the causes of this fibroid? What are the predisposing factors of having fibroid? These are the things. What are the preventive measures also that you can do in order to not suffer this fibroid? These are the interesting topics we're going to be talking about today on this show. I believe you don't want to miss out. Please, please, please don't touch that dial. Stay tuned as we take you through this journey of knowing everything you need to know about fibroid. Okay, everything you need to know about fibroid. Now, what is the meaning of the term uterine fibroid? What is the meaning of the term uterine fibroid? This is an important disease of public health importance in the Department of Obstetrics and Gynecology, because a whole lot of women now suffer this fibroid in our day-to-day society. It is a non-cancerous abnormal growth. Hear me and hear me well. It is a non-cancerous abnormal growth that happens in the uterus of various female individuals. Okay? It is a non-cancerous abnormal growth that happens in the uterus of various female individuals, usually seen when they are sexually active in their reproductive age. I take it again. Uterine fibroid is a non-cancerous abnormal growth that happens in the uterus of some female individuals, usually seen when they are sexually active in their reproductive age. Like I said, it is non-cancerous and it is abnormal, and it can lead to some signs and symptoms. It can lead to some signs and symptoms, okay? Signs and symptoms remain some clinical features. Now, you might be asking, what are some clinical features you might be experiencing when you are having this fibroid? Okay, I'm going to list them for you. Some clinical features you are likely to be experiencing when you have uterine fibroid. Number one is heavy menstrual bleeding, known as menorrhagia. Heavy menstrual bleeding. You see yourself, whenever you are seeing your menstrual flow, you notice that the menses is quite heavy. Medically, we call it menorrhagia, okay? So this is one of the clinical features you might be experiencing. Now, another feature is menstrual pains, severe menstrual pains when you're having your menstruation. This is another clinical features. Now, another feature again is abdominal suprapubic uh, formation in your abdomen. I come again. Abnormal suprapubic swelling in your abdomen. That's why you see some women that have fibroid. You see them, their tummies begin to swell up. You see their tummies becomes too big. When you see them, you think they are pregnant. No, they are not pregnant. That is an abnormal suprapubic swelling of their abdomen. Okay, that is being caused by fibroid. Now, I know that they might experience signs of anemia. Yes, they might experience signs of anemia, which means a decrease in the packed cell volume of that woman. Okay, decrease in packed cell volume of that lady as a result of that menorrhagia, which is what heavy menstrual bleeding. Okay, so now because of this heavy menstrual bleeding, you might see that woman experiencing blood vision, weakness, dizziness, headache at some point in time, or even in a day. You see her experiencing some of these things that I mentioned: dizziness, blood vision, headache at some point in time. So if you are experiencing these clinical features that I've mentioned here now, that are some of the clinical features of uterine fibroid. Now, what are the predisposing factors of uterine fibroid? What are the risk factors of uh, uh, uterine fibroid? Now, number one, being a female. Any female can have uterine fibroid. It's not for the males. Okay, it's not for the males. As men have some sicknesses they are likely to suffer from, so do we women have some sicknesses that we women are likely to suffer from. A man can't have uterine fibroid. Yes, a man can't have uterine fibroid. So also a man can have um, prostate cancer, but a woman can't have prostate cancer. Why? Because a man has a reproductive organ known as what? Prostate gland. In a man, there's what is called prostate gland. From that prostate gland, it's what can develop to that what? Prostate cancer. So a woman doesn't have anything to do with prostate cancer. So is a man doesn't have anything to do with cervical cancer, because a man doesn't have a cervix. It's from the cervix of a woman that develops to cervical cancer. So being a female is the predisposing factor of having uterine fibroid. So just bear it in mind that any woman can suffer what? Fibroid. Now, being in your reproductive years, a woman can suffer fibroid. Someone that is in a reproductive year from 15, 30 to 35 years can what? Suffer what? Fibroid. Women of reproductive age, you can believe with me, you see a lady of 20, 22, 24 developing fibroid, and you ask yourself, how? Just bear it in mind that once a woman enters her reproductive age, even from the age of 15 to 25 to 30 to 40 years, you are likely to what? Suffer this fibroid. Then another thing again is another predisposing factor of suffering fibroid is what we call nulliparity. Nulliparity. What do I mean by nulliparity? Nulliparity means a woman that has never given birth to a baby before. A woman that has never been pregnant before, or that has never given birth to a baby for a very long time. Yes, that is what we call as what? Nulliparity. A woman that has not given birth to a baby for a very long time has the risk factor of suffering what? Uterine fibroid. Now, another predisposing factor is this another one, is this one I'm about to mention now. This one is very, very, we do let it down. We don't really look into it. We don't see things into it. Indiscriminate use of estrogen containing drugs. We neglect this, but we don't know the after effects. You see a lady in her reproductive age, you're a lady in your reproductive age, you've entered into your reproductive age, and you see yourself taking estrogen drugs, you see yourself taking contraceptives, you go to see a man, after that you just take your postino2 inside your mouth. Some people even end up taking it 2 times a month. Some even in a couple of 3 months, someone has taken contraceptive more than 2 times in that 3 months. It just becomes your regular lifestyle. My dear, you're causing danger for yourself tomorrow. You're causing danger for yourself tomorrow. You can see yourself suffering from fibroid tomorrow. You can even see yourself having blocked tubes tomorrow due to those estrogen drugs you've taken in the past. Yes, estrogen drugs you've taken in the past. It should be, even if you are to take such drugs, it should be an advice from a competent gynecologist or from a competent doctor. There must be a reason. Maybe your doctor will tell you, okay, you can take this. But some people end up giving themselves self-medications. You see yourself taking those things all by yourself without even any doctor prescribing it for you. They are estrogen drugs, okay? They are estrogen containing drugs, okay? They have things that they do. They have things. It destroys your reproductive organ. It destroys your system, okay? It destroys it a whole lot. So that is why it is advised, even if you are to take anything drug, as a woman, our body is delicate. We need to handle it with care, especially when we ingest anything, be it the food you eat, be it drugs you take. Even as a pregnant woman, there are some stages you will enter, even through your first trimester to your second trimester to your third trimester. When you enter your first trimester and you're having malaria, the kind of drugs that will be given to you will be different from the kind of drugs that will be given to you in your third trimester. There's a kind of drug you will give to a woman, a pregnant woman that is in her first trimester. You will see her losing that pregnancy automatically. There is no two ways about it. There is no two ways about it. You see her losing that pregnancy, even in fission. That's why proper diagnosis is done. If you come to the hospital, they will ask you some series of questions. It baffles me that some people, if they come to the hospital, if you're seeing your doctor one-on-one, you see them hiding or withdrawing some information from your doctor. There are some people you should not lie with. You shouldn't lie to your lawyer. You shouldn't lie to your doctor, because from the things you're telling the doctor is what he or she will work on. That is what he or she will work on. Because you can see maybe a pregnant woman goes to the hospital and you're asking her, are you an expectant mother? Are you pregnant? This and that. Maybe she says no. She says no, that she's not, so this and that. Maybe they might not go ahead to give her an infusion that is not even good for her to take at that particular point in time. That woman might go home. You see her having bleeding, and from that bleeding, the baby goes out. So hear me and hear me clearly. As a woman, be very, very careful on what you ingest into your body system, even if it's drugs. Even if it's drug. Even a pregnant woman, there are some drugs you're not supposed to take, because it doesn't even only affect you, it affects the health of your baby. There are so many children that when you give birth to them, you see them having jaundice. You see them having so many complications. You see them having head fontanelle. You see them having so many complications, okay? It is, most of them are as a result of what the mother took when she was carrying that baby. So estrogen is a hormone. These hormonal drugs you're taking can lead to development of uterine fibroid. So if you're a single lady and you're watching me here from wherever you're watching me, mind the way you take contraceptives. Mind the way you take it. It is really not good. It is really not good. It may not even be uterine fibroid. It can cause you blocked fallopian tubes. It can cause you blocked fallopian tubes. Now, another predisposing factors of fibroid is what? Alcohol consumption. Alcohol consumption. Please, as you're with us on this live, please, if you have any question pertaining to what I'm talking about today, if you have any question whatsoever pertaining to uterine fibroid, please do well to like, do well to comment on the, drop your question on the comment section, as we will go back to read those comments and give you an immediate answer to those questions. Like I said earlier on, you can also invite your friends. You can also invite your friends, invite other people to join us in this live. Then also, cigarette smoking. Cigarette smoking is another predisposing factor of uterine fibroid. Another one is obesity. It baffles me that so many women don't regulate their weight. Obesity can also make you suffer uterine fibroid. A body mass index of more than 30 kilograms per meter square, that is more than it, can even make you suffer this uterine fibroid. Your body mass index, when it comes to your weight, there's what you call body mass index. It shouldn't be above 30 kilograms per meter square. So that is why it is advised for you once in a while you exercise, and also you check your weight, regular weight checking, so that you will not end up suffering what? This fibroid. Now, having told us the meaning of uterine fibroid, having told us the risk factors and also the predisposing factors of uterine fibroid, now let us go into the types of fibroid. We have 3 types of fibroid. Number 1, subserosal fibroid. What is subserosal fibroid? This is a type of fibroid occurring at the outer layer of the uterus. Uterus is your womb. Okay? Medically, it's called uterus, which is your womb. Subserosal fibroid is a type of fibroid occurring at the outer layer of your uterus. Now, we also have submucosal fibroid. Submucosal fibroid. This type of fibroid bulges in the body of the uterus. This is your uterus. If you just go and bulge there at the body of your uterus, that one is called what? Submucosal fibroid. Now also we have intramural fibroid. Intramural fibroid. This is a type of fibroid that usually occurs in the myometrial mucosa of the uterus of that lady. This one occurs inside the uterus. That's when it develops. It develops right inside your uterus. That's why we say it develops inside the myometrial mucosa of the uterus. And you can only find out the type of fibroid you have if you go for laboratory investigations. You might be seeing yourself having suprapubic growths in your abdomen, and you might be saying, I may have fibroid, but you might be saying, I don't know whether it's outside, I don't know whether it's inside, I don't know. You can only find out if you go for pelvic examination tests. It will be able to tell us the position of that uterus. That's when you see your doctor will tell you, this your fibroid is inside your womb, or is inside the uterus, or is outside you, or is so location. Okay? And fibroid becomes a very big problem when it is what? An intramural fibroid. It becomes a very big problem when it is what? An intramural fibroid. When it develops inside of your uterus. It just seems as if it takes the position at where your baby is supposed to stay. So not just go and take position, relax there, they chill. They call in brothers and sisters, they come there, they go just relax, like say that place that they are home. That's when it becomes a problem. So it's good to find out the position of your own fibroid, then take medications in order to shrink this fibroid. So many women today suffering fibroid, you find out that a whole lot of them go for surgeries in order to take off their fibroid. I'm not saying it's that bad, but it's not really that bad. But if you can get a very good doctor, if you have a very good doctor that can do that without any further complications, in time to come, you can go for that. But if after the surgeries and there comes complications and the fibroid develops back, no, 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 that's not a good one. And you know, to get good doctors now is really hard. It's really hard to get good doctors now that can do you a fibroid surgery, and at the end of that surgery it doesn't grow back and your hormones are balanced. Because what fibroid does is it scatters your body system. It scatters your body system. It scatters your hormones. It scatters them. You understand? It turns everything upside down. So even if you're taking drugs, even if you're going for surgeries, you need to be going for those surgeries and also be balancing your hormones, be balancing them so that everything will be the way it was before. You need to balance everything because already the fibroid has scattered your hormones. Your hormones are now imbalanced. And if your hormones are imbalanced, I don't see you getting pregnant because progesterone is not at the right proportion it should be. Estrogen levels has been scattered. Your prolactin has been scattered. Everything has just been turned upside down. How then will you get pregnant? How then will you get pregnant? As women have hormones in their body system, so do men also have the hormones in their body system. The men have testosterone, the men have, testosterone, which is the male hormone. It has its function. So if your hormones are imbalanced and even these your hormones are not at the right proportion, it becomes a problem. So if you're treating your fibroid, either taking medications to shrink it, your doctor giving you medications should also be balancing your hormones as well. So after treating you the fibroid, you now know that you need to concentrate now on conception. Not after, because a whole lot of women, you see them, they'll tell you they've gone for fibroid surgery. But after some series of tests, you will now see that their hormones are imbalanced. Now, someone else has done the surgery. Now, you now have to start balancing those hormones that have been scattered. Okay? So, it is very, very pertinent to understand these things very well. So, if you're treating yourself, you know what you are doing. Now, what are the complications? You might be asking yourself, what are the complications of this uterine fibroid? If I have this fibroid, what are the things that I'm likely to be seeing? What are the complications that I'm likely to be experiencing? Number one, constipation. A woman having fibroid can experience constipation once in a while, difficulty in passing stool once in a while. Okay? Yes. Then there's what we call clinical urine frequency. You see that woman, the woman tends to go to urinate often and on, maybe in a little context of time. You see that woman visiting the toilet to urinate, and at that point, some women tend to develop some urinary tract infections because of this. You see them, so many of them develop urinary tract infections because of this uterine fibroid. So I don't know, if you have questions, you can do well to drop it in the comment section because we'll be attending to those questions one after the other. We'll be attending to those questions one after the other. I've explained the meaning of fibroid. Okay? I've explained to us the meaning of fibroid, the risk factors of fibroid, the things you're likely to experience when you're having this fibroid. Okay? the things you're likely to experience when you're having this fibroid. So do well to drop your questions in the comment section, as we'll be uh, looking forward to answer them right now. And also invite your friends to join us, because you cannot afford to keep this knowledge, keep this information only with you alone. You have to invite other people to join. Please invite other people, invite your friends, invite other persons to join us in this live. And you can feel free to ask your questions. Feel free to ask anything whatsoever you want to ask. Feel free to ask your questions before we go to the preventive measures, general preventive measures for this uterine fibroid. General preventive measures for uterine fibroid. What are the things that you need to be doing so that you will not suffer fibroid? What are those things that you need to, what are the lifestyle you need to engage yourself in so that you will not suffer this uterine fibroid? Okay, I'm seeing a question here. Hope Nathaniel. Hope Nathaniel is asking, what of someone that doesn't take any of those drugs and still have fibroid? Okay, you're asking, what of someone that doesn't take all these estrogen drugs, all these contraceptives, but still has what? But still has fibroid. I said something earlier on. I said something earlier on. As a woman, you're likely, as an African woman, uh, as an African woman can suffer this fibroid. You can believe with me, this fibroid is prevalent more in the African women. Is more prevalent in the African women. Okay? So if you don't take those estrogen drugs and you still see yourself having this fibroid, just know that fibroid is prevalent in the African women. If you go outside the world, the whites, the Europeans, you find out that this fibroid is not really prevalent over there. Just know that fibroid is prevalent in the African women. So if you see yourself having fibroid, all you need to do is to look for possible solution in order to shrink that fibroid so that you can end up conceiving and carrying your own child. Because if that fibroid is an intramural fibroid and is in your uterus, it will be difficult for you to conceive, to carry your own baby. Okay, so that is why, even if you notice that you have that fibroid, do well to look for a possible solution to tackle it, to shrink it, so that you can be able to carry your own child. I think I have answered your question. I think I have answered your question. If you still have any other questions, please do well to drop it in the comment section. Do well to drop it in the comment section as we go over to uh, the general preventive measures. Okay, do well to drop your question as we go over to the preventive measures of fibroid. Okay, now what are the general preventive measures that we can engage ourselves in so that we don't have to suffer what? Fibroid. They are divided into the modifiables and non-modifiables. Modifiables, in the sense, the one that you can change. What I mean by modifiables and non-modifiables, the ones you can change and the ones you cannot change. That is what to uh, uh, divide them into. Now, what are the uh, non-modifiables? Age. Any woman in her reproductive ages from the ages of 15 to 40 years can have fibroid. This one you cannot change it. I'm not the one that made it. You cannot change that one. Okay? Any woman can have that fibroid between those ages from 15 to 40 years of age. Then being a female also, being a female makes it likely for you to what? Have this fibroid. And also being an African woman, you are likely to experience fibroid more than the whites, more than any other persons in the world. Now uh, to the modifiables, the ones you can change. Alcohol consumption. If you know you take alcohol, if you know you take cigarette, if you know you uh you take all those things, please endeavor to put a stop to it, because it has a way of making you suffer this fibroid. Then I made mention of obesity the last time. Obesity. If you know that you have your weight is high, and when it's being measured in body mass index, it is more than 30 kilogram per meter square, please do well to uh, reduce your weight. Okay, do well to reduce your weight so that you may as in so that you will not suffer this fibroid. You can do it by doing regular exercises. You can do 30 minutes exercise every in a week. You can do it 3 times in a week. At the end of the week, you should have given your 150 minutes to exercises. Like from maybe in Monday you did 30 minutes exercise, on Wednesday you did 30 minutes, Friday you did 30 minutes. Just be working on yourself. Regular exercise helps. Then also seeking medical attention. Seeking medical attention. If you see yourself seeing maybe any of these signs, you're seeing your the development of your abdomen, you're seeing abnormal suprapubic growth in your abdomen, please do well to consult a medical doctor, do well to consult a medical personnel, because the person will help you to regulate and check you up and give you an adequate treatment so as to make sure that you don't the case doesn't complicate or makes you suffer more tomorrow. So I believe we've talked mainly things you need to know about fibroid, the meaning, the types, the predisposing factors, the preventive measures, and all of that. So I'm still going to take more questions. Okay, Joy Anthony, I'm seeing your question right now. You're asking, what about the fibroid that is inside the womb? What will you do? That is intramural fibroid. Like I said earlier on, if you find out that you have intramural fibroid, what you can do is see a medical doctor, someone that can help you shrink the fibroid. At EJ1 Fertility, what we do here, we don't do surgery. What we do, we give you treatment. We give you treatment with natural remedies, natural herbs that will help you shrink your fibroid. Even if it's intramural fibroid, be it subserosal fibroid, be it submucosal fibroid, it will help you shrink that fibroid. So you don't have anything to be worried about. You don't have to be scared, even if it's intramural fibroid. Just seek the adequate measures, get the adequate drugs that will help you shrink it. And you believe in me, when that fibroid is shrinked, you will see yourself conceiving and you see yourself carrying your baby, because what is blocking your uterus, what is now blocking the place your baby should be, is now empty. There is no obstacle there. The environment is now conducive. That you having fibroid in your uterus is just a way of telling your body that this environment is not conducive for a baby to stay. So a baby cannot stay in there. The environment is toxic. The baby cannot stay in there. But when the fibroid is drastically reduced, it is shrinked totally, thoroughly, totally. You can now see yourself carrying your baby. You cannot see yourself carrying your baby. Okay, someone is asking again. Madam Joy Anthony, I believe I've answered your question. Someone is asking again, is it true if a woman doesn't conceive till age 35, fibroid will grow inside the womb? Yes, I said something like that. Nulliparity. I made mention of nulliparity. A woman that has not conceived, a woman that has not conceived over a very long time, a woman that has not been pregnant over a very long time, fibroid tends to grow. You see fibroid growing because that environment has not carried a child over a very long time. That's why some persons, you might see them, they've given birth to one child, maybe after they've stayed 7 years, 8 years, they'll not see fibroid developing. They'll be like, but I gave birth to my baby many years ago. How come now fibroid is developing in my womb? Okay, that's what we call nulliparity. A woman that has not given birth to a child over a very long time, or a woman that has not given birth to a baby before, it doesn't matter your age, whether you're 15 to 35 to 40, that's what we mean by nulliparity. You can suffer this fibroid. Okay, you can suffer this fibroid. And I don't advise people, if you are married and you know the number, every couple, every person's have the number of children they tend to give, they will hope to give birth to. Maybe you say, I want to give birth to 3, or I want to give birth to 4 children, I want to give birth to 2 children. Okay, let's take for instance someone that says she wants to give birth to 4 kids. Then you've given birth to two kids, and you now say, let's wait small, honey. You like say we go just rest small, let's just rest small, maybe in 2 years, 3 times pregnancies to be doing that. My dear, you're causing more harm than good to yourself. Oh, you are causing more harm than good to yourself. It is better. I don't even advise, or women that go for family planning, many intrauterine devices to prevent pregnancies, maybe women that go for property, women that go for some contraceptive drugs in order to prevent pregnancies, why they know fully well that they've not finished giving birth. They've not finished giving birth. You know, all those things works on your hormones. Some women, you see them come to the hospital, they be like, doctor, please, can you just remove this copper T? I want to start giving birth again now. I think I'm ready to be giving birth. And when you remove that, you see that woman going back. In a year, she has not conceived. In a year and 2 months, 6 months, she'll be like, what's the problem now? You don't know that thing inserted is a hormonal, it works with your hormones. I advise, if you get married and you want to start conceiving, just follow, drop one, you continue. Once you know you are done, you don't have anything to do with giving birth again, you can now go for family planning. You can now go for family planning. And you know, women, our body tends to be different. Some contraceptives tends to work for different people. A woman can put copper T, a woman can put this, another person might put it, you might see her having bleeding, you might see her having some complications. So it's for you to understand the one your body is works with, and you can only understand that if you visit your doctor or your health personnel. So my dear Thelma Khadija Ola Atanda, I think I've answered your question. If a woman doesn't give birth to a child for a very long time, that place is empty, nothing is growing there, she has never given birth to a baby before, fibroid tends to grow in. Okay, Hope Nathaniel, Hope Nathaniel is asking, can multiple fibroids be shrink with herbs? My dear, yes. Yes. My dear Hope Anthony. Sorry, Hope Nathaniel, right? Yes, Hope Nathaniel. Multiple fibroids can be strength with herbs. I can give you 100% assurance to that. When you see people talking about herbs, what are these herbs? They are those natural remedies you use even in your kitchen, that you use in cooking, that you don't know that they are medicinal, highly medicinal. I'm telling you this. I am telling you this. There are herbs you use in your kitchen. You see your garlic, you see your ginger, you see your turmeric. All those things has a high medicinal value. I am telling you. There are some herbs that you even use in your kitchen, even if you're having an infection and you don't want to go and spend money or throw away money to buy drugs. Those herbs, if you cook it, boil it, drink it adequately, that infection, you will not see it again. I bet you on that. So you can use herbs. You can use herbs to tackle fibroid, to shrink it all off out of your body, be it single fibroid, be it multiple fibroid. Okay, you can use herbs to shrink your fibroid. Okay, so Obi Promise, my dear Obi Promise is asking us, what makes fibroid to regrow after surgery? What makes fibroid to regrow after surgery? My dear, you know, fibroid tends to grow from what you eat. From what you eat. You can believe in me, if someone goes to a hospital now, goes for pelvic scan examinations, and at the end of the test, you get to find out that the fibroid is small, it's small in size. And you don't tend to control what you eat. You're eating anyhow, you're taking proteinous things, you're taking your eggs, you're taking milk, you're taking things made with butter, you're not imagining what you eat. My dear, go back to check back that pelvic scan examination in 6 months. You believe in me that that fibroid has grown much more bigger. Much more bigger. Okay? I am not giving you 100% assurance that if you do a fibroid surgery and it tends not to grow back. So many persons that comes to the clinic will tell you, Madam, please, I've done fibroid surgery, or I did it 2 years ago, I did 3 years ago, but I don't understand what is happening again. I've gone to test again. They are telling me that the fibroid is growing back. That is why natural remedies cannot be overemphasized. Natural drugs, natural remedies, you see roots and herbs. There is nothing. All those ones are things naturally made by God. I can bet with you that if you go into the bush, every plant you see growing in that bush has a medicinal value it gives, but it's just that maybe you've not gotten an inspiration, or you don't know what each particular one works. That's why you might see and ignore. Or you see some people that are into roots and herbs going into bushes, they will plug this, they'll plug this, they'll plug this. Even in the olden days, you see them going to the bush. What they used to treat is natural roots and herbs. Those days, there's nothing like hospital now. There's nothing like medical doctors. What they go into the bush. If you're having bleeding, they know the roots, they know the herbs to go into the bush and pluck, cook and give a woman. That bleeding will stop. I am telling you the gospel truth. Maybe it's a woman that gave birth after the delivery. You see her having bleeding. You see them going to the bush, they'll pluck that leaf, cook it, and once that woman drinks it, you will see that bleeding stops automatically. My dear, natural remedies cannot be overemphasized. They are natural gifts to us by God. Okay? They are natural gifts to us by what? By God. So I am assuring you, giving you a 100% assurance that if you use natural herbs to treat, to get rid of your fibroid, my dear, nothing, I mean, nothing can make that fibroid to regrow back. As far as it was really shrink out, like you after the treatment, you went for test and it was confirmed that there is no more fibroid again in your uterus. Because one woman came here with us. She told us she has fibroid. We gave her treatment. I was even surprised. At the end of 1 month, that was just 1 month treatment of fibroid, that lady came back with a pelvic scan test, and it was shown in the test that no more fibroid. Someone that went to test and they told her fibroid is seen. Look at the measurement, look at the position. Then after 1 month of giving her drugs, she came back with the drugs and it was confirmed medically. This one is not the one that will hide and tell you don't go and do test. It has cleared. Don't go and do test. Oh. Don't worry. Don't bother yourself. You will go and do test. You will confirm by yourself. We are not the persons to confirm for you. Laboratory investigations confirmed that the fibroid was no more. And I had to interview that lady. I had to ask her, ma, please, because this just seems like a miracle. How did your fibroid tend to drastically reduce, like shrink all off within 1 month? She told me that we told her to be taking her medications morning and night. But she was like, morning and night is not even enough. That woman was taking medications morning, afternoon, night. Morning, afternoon, night. Morning, afternoon, night. We only told her to be taking morning and night too. She said she doesn't joke with the medication. She makes sure she takes it adequately. And most persons that will come back to us and tell us that they are not seeing results, if you check out those persons, one, they are not taking their drugs adequately. Two, they are not adhering to the food plan you gave to them. Some persons will come, you ask them, hope you're not eating this. Then, ma, please, oh, during December, it's festive period now, so you have to enter different ceremonies. I couldn't afford not to eat chicken. I couldn't afford not to eat turkey. I couldn't afford not to eat this. I couldn't afford not to eat egg. And you want your medication to work. So because it's festive season, you will not forget that you're on a food plan. There are things you are not supposed to eat. Because it's festive season, you now open your mouth, open your everywhere and be eating. How do you expect the drugs to work for you? So food plan is necessary when you want to deal totally with fibroid. And mind you, it's not like we feel happy telling you not to eat all those things. It's just to help you and to help us so that you get your result, and so that you get your testimony and say of a truth, our drugs are really working. You understand? To tell us that yes, our drugs are really working. So, and you will not adhere to those food plans forever. Once you are adhering to those food plans and at the end your drugs, you get your results, it's confirmed that you no longer have fibroid, my dear, you're free to eat whatever you want to eat. But you see that surgery of the stuff that you go and do surgery, and at the end you still go back to be eating those things you are not, my dear, the probability that the fibroid can grow is 100%. But in natural remedies, the thing is there that it will not grow back. You understand? That is the difference. That is the disparity between using surgery to treat your fibroid and using natural remedies to treat your fibroid. So I believe I've talked to some extent in this case, in this ailment called fibroid. I think I've talked at length. Yes, at length. Akinleyi Aderonke, please, I cannot get your question. Have you been able to resolve it? I don't. Okay. Sorry. Okay. So I don't know if you have any other questions to ask. Feel free to drop the questions in the comment section. Yes, in the comment section, okay? And you know, today is International Women's Day. Just know that you are a powerful woman. Whatever you set your mind in to achieve, you must surely achieve that. We are bold, we are smart, we are um, we are a priority. Just imagine this word without a woman. It will be somehow. It will be some. It will just be somehow. So happy International Women's Day again to everyone watching me right now and to all other women all over the world. Please celebrate yourself. Celebrate yourself. You are extremely wonderful. Okay? Celebrate yourself. So, so far, so good. In conclusion, EGN1 Fertility and Womb Massage Clinic is a clinic that deals with natural remedies to tackle fibroid. So if you know you are having fibroid and you want to tackle it, you want to say bye-bye to fibroid entirely, okay? You want to say like bye-bye to fibroid, bye-bye to you. I am not having you again. Feel free to chat us up. Feel free to chat us up to get your fibroid drugs. And I bet with you, you're surely going to get results once you adhere to our instructions, once you adhere to our food plan, and be consistent with your medications and be true to yourself. You must surely get your results. Okay, so feel free to order your fibroid medications from us. For people that are in Lagos, you can visit our office, you can visit our clinic. We are located at 4th Avenue, I Close, Festac Town, Lagos State. And for people that are not in Lagos that may wish to get this medication, we also do waybill delivery to any part of the country, even if it's not Nigeria. We do delivery to any part of the country, be it outside Nigeria. So do well to order your drugs. And remember, it is very, very pertinent to live a healthy lifestyle. Once you're living a healthy lifestyle, you're running away from several things. You're running away from several ailments, from several diseases, from several infections. And also do well to always keep your environment clean, okay? Because our environment tends to also affect our health. Some persons believe that Staphylococcus aureus infection can only be gotten through sexually transmitted through sexual intercourse. No, my dear. Staphylococcus aureus can also be gotten from your environment, okay? Dirty environment. You eat and you stock up your plate in a place and you fail to wash them. You see flies perching on them and you see that fly again going to perch on the food you eat, my dear. You are taking in some harmful things and you see yourself, when you take in that food, you see yourself suffering from food poisoning or some infections. Not all infections are gotten through sexual intercourse. Staphylococcus aureus can also be gotten from your environment. So please do well to live a healthy lifestyle, take care of yourself, and do well to join us same time, same place next week when we will come with an interesting topic again to discuss with you all. We will come with an interesting topic again to discuss with you all next week. So do well to always like, comment, and share our post. If you know that you are our follower on Facebook, please do well to like, comment, and share our posts, okay? Because you know we remember you all once in a while. So thank you very much. I think I'll be drawing the curtain here today on this show. Thank you for joining us. Thank you for being with us. Thank you for not touching the dial. Thank you for being with us today in this show. I love you all. I love you all. I love you. I love you. I love you. And I remember your humble host, your humble girl, Nose Gift. Thank you for watching and live a healthy lifestyle. Bye.